Hi. Um, I'm very happy to meet you again tonight. We're gonna really discuss a very simple but important subject. The subject is how to live with COVID. And we're gonna talk about prevention. Prevention is our best protection. So we're gonna talk about very simple measures that we can do that can really will make a big difference. We're not gonna talk about vaccines, antibiotics or antiviral or sophisticated monoclonal or polyclonal or how this virus replicating, how it changes itself, because it's a very tricky virus and it's a RNA virus. RNA is the single strand of the molecule of the of the genes, and it's really very sophisticated in a lot of ways, and it modify itself very fast. It make a lot of changes. It's even working at different ways to control the cells, control the replication, control how the immune system and the way that our body is fighting viral infection or other infection, and make it confuse. So it confuses the system that really attack the body and cause this big waves of the storms of the reaction that end by killing the good cells and the bad cells and causing multi-system failure. So now we're going to talk about very simple thing. The whole game here that we're trying to do is to limit the rate of infection so we don't have a big number of people getting infected, and even when they get infected they might get it in a very minor condition, so they don't really get a big severe disease, because the severity make a big difference in the outcome. At least half of the people so far get the infection and they don't have symptoms or have very minor symptoms, and a lot of them don't get even like diagnosed, or nobody even know about it unless they go for random checkup and then they find that they had the antibodies in their system. And I see this in a lot of patients now, of my patients. I'm not talking here as a doctor. Your doctor is your personal doctor. You have to take all the recommendation and all of the plans from him or her. I'm not your doctor. I am advisor. I'm just giving advice. So I don't want people to feel like I'm replacing your doctor. No, this is not my role. I'm like helping the public health people to extend the community help from other professionals and people who are really trying to be like an advocate and help us. So we teach you in the last video how to wash your hands for 20 seconds, just reminding you, and how to wear a mask, and how to keep at least 6 feet distance, it's almost 2 meters, and also how to keep the social distancing in the right way, and how to deal with the other people and to avoid the crowded places. Because the new studies show that the severity of the disease, even it really get worse when multiple people get infected at the same time. It happened in big gathering like concerts where a lot of air is blowing and they have a lot of like breathing and the shouting and making voices, and this is one place. And also in a big places where they have like cheers, like big games and some stuff like that, and even in the gym, because the people breathe hard and they breathe strong, so it might really cause spread of this if to many people, that the virus will have a chance to replicate itself and change its genetics, so they can become more resistant to certain things that we were able to control it with. So today we're going to talk about the simple measures which we can do it but you have to check with your doctor before applying this to yourself, because everybody has different medical condition. If you have medical condition, you have a doctor, you have to check with him. Can I take this? Can I do this? Or I cannot do it. That's very important. So the simple fact is like this: sleep enough hours, at least 8 hours a day. It make your body recharge itself and make you able to get in a good condition, especially the immune system. Second, try to decrease the stress. Stress is a very big killer, and we will have one video especially for stress and the modality how to live with COVID and relieve the stress, because I believe this is one of the most important things. And I'm gonna try to bring one of my psychiatrist friends to make like a video with him through the Zoom or any kind of modality, so we can exchange the information and see how we can really deal with this important factor. The third thing, drinking water. Water is a very important thing. So we need to drink plenty amount of water. Myself, I believe drinking room temperature water or even warm water is important. If you put a little lemon on the water, it makes it more like helpful to the system and boost the immune system. If you drink a small spoon of vinegar, can really help you with the weight and appetite and things like that, and make you even have a better control of the fat, which is a very important factor. This not very much for the COVID. We're gonna talk about the vitamin that they all agree now that it did show that it will help the severity of the disease, or make it a limited severe disease, or make the immune system able to fight it and not to get to the severe form and hospital admission, or even a ventilator, or even the worst case scenario, death from it. So the first thing here we're going to talk about it is vitamin D. Vitamin D, like David. Vitamin D is one of the elements that here in Northeast and the northern part of America, we have low vitamin D. And almost like universal, our level when we check it is very low or in the lower side. So we need to bring vitamin D level in our body around the normal level, which is like 30, or we can really, if it's better if we bring it around 50. I believe the daily need for this, it might be 2,000 IU or international unit, or 5,000 international unit will make it every day. If people want to have a low number and they need to take more, they have to check with your doctor too. But that's a very important element. And I believe like right now, it's important that people get checked and see how is their number, and ask their professional doctor to tell them what is the best way to elevate or bring it up, so people can have a better level of vitamin D, which is a very important vitamin for the body. And I believe it's one of the missed vitamins that a lot of people don't take it, or don't really have big attention toward it, and it's not even checked by a lot of physicians, because it's expensive blood test. So a lot of people feel like it's even worth it to take the 2,000 international unit for the rest of your life, better than just checking the level. And that's a controversial between even the medical community, like doctors. So vitamin D is also good for the bones, for the skeletal muscles, for the feeling well, and make people feeling, better, and actually help some other condition. But here for the COVID, it's one of these vitamins that shows that people with low vitamin D get more severe COVID, and they get more complications. So that's important one. Number 2 is zinc. Zinc is one of the elements that we don't really get enough. We can get it in our meals, in the meat and some other stuff. A lot of time we don't get enough, and maybe we don't get enough absorbed in our system. As an element, it has some antiviral effect, and it shows that it really helps the immune system to fight the viruses and decrease the severity of viral diseases like flu and here with the COVID too. So it's one of those elements that need to be addressed and to be taken, especially in the winter time now that's coming, because it will really help us to fight the cold symptoms and the condition, but also under supervision of your own primary care doctor or private doctor, not under my care. I am not your doctor, I'm advisor giving this advice, but I cannot really give advice for people to be treated or anything like that because I'm not your primary doctor, I don't know your condition. So it's important that everybody understand this. Don't say, he said that, do I need to take it? I would take it. It's your responsibility. A lot of people go to those vitamin shops and they get a bunch of things. Most of the time nothing happens, but if something happens, people need to educate themselves and make their doctors aware, and they can tell them if it's completely contraindicated or it might be okay or not, he's not sure, or don't take it because it might affect your conditions. So you need to do that. The third one, which we all, I think most of us take it, is vitamin C. Vitamin C is one of those essential vitamins that really help with the cold symptoms and with allergy even and some stuff like that, help our immune system. And the importance and help, it does help, and I believe it does help with those things, but same thing. You need to check with your own doctor before taking anything like that, because I don't know if you have other medications that can interact with those supplement. And it's like any other holistic medicine or vitamin. It has its own good part, it has its own bad part, but it all depends on risk and benefits and alternatives. When we are fighting like a pandemic, we need to check. If it's good for me, I take it. If it's not good for me, I take one or I don't take the other one. And it's a very personal thing because God make everybody special. So it's not like one size fits all. Not everyone can take all of those ones. But you have to look at it, you have to figure out, you have to talk to your personal doctor and see what you need to do. It doesn't replace the social distancing or the mask or the sanitizers or any kind of measures that protect people from getting the disease, because it's like different modalities and something can help almost everybody, like the mask, but some people have issues with the mask. They have to check with their doctor. Maybe they have breathing problem, maybe they have other problems, and they might need to use other modalities other than the mask, like the face shield or something like that, but it has to be his personal doctor who gave this advice. We just want to make sure people will really make themselves ready for this, so you better check with your personal doctor about those supplements. You have to ask if it's good for you, and you have to have it. So when you need it, you find it. Because during the pandemic, most of those things were off the shelf. You cannot find vitamin C, you cannot find zinc, you cannot find vitamin D, you cannot find toilet paper, you cannot find paper towel. America was a big mess with this. And I believe with the second wave, we will be more prepared, and I hope that we will have a better preparedness for the second wave and to be more ready and to prevent things before it gets bad. And we have to work with each other so we can have a better outcome for all of us, so we don't have to lock up lock down the whole entire state or a county or a city or something, or even the whole entire United States. And if there is some increased cases and big numbers of people in certain areas, we need to make the precaution and even stop the airlines to and from those places. And we have to check the people. If we have, people coming from, let's say, Europe now has some increase of the cases, they need to be checked for COVID like 2-3 days before coming here, before we allow people to come back, or because we need to make sure we don't get another big wave like we did in March 2020. And it's a very important thing. We need to learn from our past so we can do better in the future. I believe we'll do better if every one of us knows his role and knows what he needs to do, comply with the rules and regulations, don't fight it, let's pass it. It's gonna be like maybe 2 more years with this big things until we settle with something better. And I believe we can do better with all of this instead of what happened in the first wave. I think this is my summary for this, and I believe we will do better next round. And I believe when we are united and we do things together as one nation, we will do better. And God bless America. God bless you all. And we hope every one of you will do good. This is Dr. E with me from the YouTube. God bless all of you, and thank you very much, and have a nice evening. Bye. Have a good night.